So I will turn now to looking at some of the numbers and updating people on the epidemiology and some of the modeling, and also some of the information that we've obtained from you around the impacts of the pandemic and the measures that we've put in place over the last little while. So to start with, we'll talk a little bit about the epidemiology. This is a profile of the last week that we've seen. As we know, we've had a steady increase in new cases over the past week. And along with that, what we've seen is a decrease in the median age of people who are being affected. And I'll talk a little bit more about that. We have 550 people now who've been hospitalized, 8 new people. And again, the median age for hospitalization remains in the high 60s. And we have had a single death in the month of August, and the median age, of course, for people who have died remains quite high. This is our epidemic curve, updated to the end of last week, and this is by reported date, so that's the date that the test was reported. As you can see, we have a number of epidemiologically linked cases and laboratory diagnosed cases, and we've seen a steady increase in those cases, particularly since the beginning of July. Looking at them, however, by date of onset of illness, which is something that we do in public health when we do these case investigations, and we also look at where people have been exposed. And so this epidemic curve shows this by likely source of infection. And what we can see is that most people are related to local cases and clusters. And this is the work that we're doing. We talk about contact tracing, being able to find people who have been exposed and make sure that they're in isolation. And that's how we stop those chains of transmission. So there are very few people who we don't have a link to in the province, despite our increasing numbers. And that's really a testament to the work that's being done by public health teams around the province. I will also note that we do continue to have introductions into the province from international travel. Some of these are our temporary foreign workers who have come in from countries, particularly Mexico, and a number of them have become ill while in quarantine. And as you know, we have been providing quarantine support for all of the temporary foreign workers coming into British Columbia for 2 weeks prior to them going to the farms. And that has, I think, averted a number of potential outbreaks in farm settings. As well, we continue to have Canadians returning from other places around the world, including recently a number of people returning from India, from the U.S., and we have had a number of cases related to that as well. This is an update of the geographic distribution of our cases by health service delivery area, of where the person resides. And again, you can see that all areas of the province have been affected. And though we've had increases in particularly interior health, the bulk of the cases still are located in the lower mainland of British Columbia. When we look at the age groups, and this is something that we've been looking at and following over time, but what you can see from this figure is that we've started to see a rapid increase in the last few weeks in younger people. And that's reflected in some of the numbers that we're seeing, as well as the discussion we've had over the last few weeks of exposure events, particularly social events, parties, get-togethers where younger people are coming together and the virus is being spread. The top line in the sort of dark pink is the 20 to 29-year-old age group, which we can see has gone up the most. And the green line just under that is 30 to 39. And we're now seeing that the proportion of cases by different ages has shifted. And in this graph, you'll see the proportion of cases in different age groups by phase of our pandemic. So the first bars represent January to May January to middle of May, and we can see it's fairly evenly distributed. What we see is a preponderance of older people, and as we recall, many of the people who were infected early on reflected the outbreaks we had in long-term care homes. So there was younger people who were the healthcare workers providing care, and older people. And as we moved into phase 2 of our pandemic here in BC, we got a hold on some of the issues around long-term care, and we started to see an increase in younger people. And that was reflecting transmission events that we were seeing and some of the outbreaks we were seeing in workplaces, some of the poultry plants, for example, the correctional facilities, and younger age groups being affected. And now, between June and August 8th, we've seen a much broader increase, particularly in people in their 20s and 30s, and this is again related to some of the social events. There is still, of course, people reflected in there from workplace exposures, including healthcare workers, but it is also being driven by what we're seeing with people gathering and having social connections where this virus can be transmitted quite easily. These two graphs give us a better sense of that. When we look at the one on the left is under 20 years of age, and then from 20 to 39. And what we see over the 3 phases of our pandemic here in BC is that we've moved from having household contacts and being involved with outbreaks to having a shift in the connections and the exposure sites where younger people are getting exposed and infected. And what we call those our other known exposure really refers to places like bars and clubs and parties and social events that we know have been an issue in the last few weeks. Wanted to present some information around the ages of people who are getting infected in our province, not only to reflect that we are seeing a disproportionate increase in young adults, but also to remind people that we monitor very carefully for younger people as well, and we still see a very few infections relatively in children, particularly children under 10. We're now up to 78 children under 10 who've been diagnosed with COVID-19, 2 of whom were hospitalized. And so this reflects about 2% of our cases in the province, whereas children under the age of 10 are about 9% of our population. So they're underrepresented. Same goes for older children, 10 to 19 years of age, where we've had now 162 people diagnosed. And again, that's 4% of our cases in a population that represents 10% of the proportion in the population. In both those cases, very small numbers. Only 3 out of the entire group have required hospitalization. We've had nobody who's needed ICU care, and thankfully nobody who has died. We can also see that we've started to see a shift in the young adult age groups, where they make up a disproportionate now proportion of our cases, where 17 or 18% of our cases are in those age groups compared to their representative in the population of being only 13 or 14%. We have, of course, had an increased representation of older people in our cases, and we know that reflects primarily transmission in long-term care homes. And then you've seen this before. This is the distribution of our cases, people who were hospitalized, people who ended up in ICU, and deaths, and comparing them by age. So the first bars that we see on the far right are the proportion of that population or that age group that's in the general population in BC. So for those under age 10, it's about 9%, as we said, and the proportion of cases. We then move on to see that hospitalizations are very rare in young people and even in young adults. And we have had very few people who required ICU care, and we've had no deaths in anybody under the age of 40. The deaths, unfortunately, are heavily skewed to the older population, particularly people over the age of 80. Some of the things that are really important for us in being able to ensure that we can detect cases and manage outbreaks and clusters as they occur is our laboratory testing. And so I've presented a little bit of information about the tests that we're doing per week, the capacity for us to test, as well as our turnaround time. And as we can see, our numbers of tests are going up again as we are finding more people who've been exposed, and we're encouraging people to be tested with any symptoms at all. We've done, just today, we did another 3,800 or so tests in the last 24 hours. Most of the tests that we are seeing, the turnaround time is less than a day. There are some areas where testing has been increased quite a lot, and that turnaround time may be a bit slower for periods of time, but our lab capacity now is good, and we are continuing to build out our lab capacity as we go into the fall, and our intent is to be able to have rapid access to laboratory capacity at about 20,000 tests per day across the province. Some of the things that we have been following, as you may remember, is some of the modeling about the connections that we're having in BC and where that is putting us in terms of potential for the outbreaks to grow. This is our mobility data, and it shows again that we are slowly but surely increasing our connections in our communities. I'm particularly heartened that we're continuing to increase our use in parks and green spaces around the province, and I think that's a very positive thing. But we're also going to the grocery store, residential areas, retail areas more, workplaces and transit are increasing as well. And we know that as we increase those connections and those pieces in our community that are so important, that includes us connecting with others as well as our economy, that we need to do it in a safe way, or we risk transmission of the virus on a broader scale. And the modeling that we've been doing, the compartmental modeling, helps us understand where things are and where things could go in the future if we don't take the actions and the measures that we know work. So we have been bouncing around a little bit above 1 in our reproductive number. So that is the average daily number of new infections that are generated per case. And we know that we want to be under 1. We want to be sort of hovering around 1. That means that we're opening up as much as we can without putting things in risk. And we are able to do that. What we see in this is that when we pay attention to it, we can bend that curve back down. And we are now starting on a bit of an upwards swing again, and we need to pay attention to that. When we look at the modeling, and I've shown you this before, this is an extension of the projections. It shows that, no surprise, as we knew, as we started to increase and open up and move into our restart phases, we were going to see more cases. But what we need to do is make sure that we are having, that we're still able to manage those rapidly through our contact management, our case management. And what this shows is where we are. We are on an upward trajectory. That is concerning, but it's not a predictive model. It doesn't tell us what's going to happen. It tells us what can happen. And right now, we have it within our ability to make the changes we need to bend that curve back down. And this is the graphs that you've also seen before, the scenarios that we could see in our future. So we're probably somewhere in the scenario that says contact rate at 70% of normal. But we can bend that curve back down by making sure that those contacts are safe. And that includes things like our safe distances, keeping our numbers small, making sure that in those times where we can't maintain those distances, we wear masks. But most importantly, it's about staying away from others when we're sick, minimizing those opportunities for this virus to spread rapidly to large numbers of people. Part of how we are able to manage, despite the fact that we're seeing increased numbers of people who are testing positive, is because we have very active teams that are managing every single case and every contact that has been exposed. And we know from our modeling that we have scenarios that help us understand how we need to do this and how we need to do this efficiently. So we are in that that place right now between moderate, which we were doing very well. We had quite strong to moderate physical distancing or social distancing measures in place. We're now moving towards the weak social distancing measures. And part of that is us being able to open up and restart our communities and our economies while living with this virus. So we are at the point right now where it's really important not only that we find everybody, but we do it in a timely way. And that is one of the reasons that we are bolstering our teams of people who work on contact tracing in public health. There are people around the province every day doing this work, and we're going to be supplementing that with other people as we announced yesterday. And again, this scenario tells us that complete contact tracing helps ensure that we can continue with our restart, we can continue with our surgeries, we can continue with our visits to long-term care, people getting back to work and opening our schools if we have our strong public health system in place as well. So as we have relaxed our measures to open up, strong contact tracing has provided a buffer. And we need to continue to provide that buffer, but we also need everybody to do their part to minimize the number of cases that we need to follow and minimize the exposure events, because the two of these need to work together to keep us on a flat, steady line for the next few months. Finally, I'm going to give some of the information that we learned from what you gave us in the Population Health Survey, Your Story, Our Future. I think this is incredibly important for all of us to understand how the pandemic and how the measures we've put in place have impacted our communities across BC. And this is just a reminder that we had over 390,000 people respond to this survey and tell us how it was affecting them from all parts of British Columbia. So one of the most important things we needed to understand was how the impact of these measures differed on people of different racial and ethnic backgrounds. And that was one of the important reasons we asked those questions in this survey. And as we can see, there was a differential impact on racialized populations in British Columbia. Not a surprise to us, but it is something that we need to pay attention to. We've seen around the world that this virus and the measures that have been taken do expose some of the differential impacts or some of the inequities in our communities, and we're no different. We see that that West Asian, Latin American, and South Asian respondents were more likely to report increased difficulty meeting their financial needs during this period of time, and more likely to report not working directly because of COVID-19, whereas Caucasian respondents had less difficulty making ends meet, fewer were not working, they were less likely to avoid healthcare and had less food insecurity. The other areas we looked at were around difficulty accessing healthcare, and again we see a differential where 30% of Japanese, Korean, and other South Asian respondents were more likely to report having difficulty. And also we see some positive things that are different by racial and ethnic backgrounds, including the fact that Latin American, Southeast Asian, and Black respondents were more likely to report an increased connection to family, which is a positive support and helps in terms of resiliency when these measures are happening. The other concerning thing, Caucasian respondents were more likely to report things like increased alcohol consumption, which can be concerning in terms of helping to cope with the measures that we've seen during this pandemic. We've also been looking at the impacts on people with lower income, by income, and we do find that individuals in the lower income strata suffer more negative economic and health consequences from the pandemic. In particular, they had people in the lowest income level had difficulty meeting financial needs, where up to over half had concerns in that area. 40% were food insecure because of the pandemic, and a quarter of people in the lowest income bracket were not working due to COVID-19. In addition, people with lower income were more likely to have chronic health conditions, experience increased concern about their health, were less able to stay home from work when they were sick, and this reflects the jobs that they were in, and they had more difficulty accessing health care. The other thing we wanted to understand more of was the impact of households that had school-aged children, and whether there was differences by racialized groups on those households as well. And what we find in this is that although a number of racialized groups were more likely to report that children experienced impaired learning, what really strikes me across the board, all parents, 2/3, 3/4 of parents with households with school-aged children reported that their children had challenges with learning during the past few months. We also heard from parents that 78% of them reported decreased connections with friends that was concerning, and 59% reported increased child stress. This, of course, was reflected again among economic differences in the households. Though across the board, 76% again had children's learning was impaired during the pandemic. 78% of people reported decreased connection with friends, and again, 60% reported increased child stress. So these are all important considerations for how we move forward and the decisions that we're making for the coming weeks and months. So that is the update on the numbers for today. And I think what this shows all of us is that this pandemic has created incredible uncertainty, anxiety, and many challenges. But the challenges have not been shared equally. We know it has affected communities across British Columbia, but we know it has differentially impacted those of lower economic status, people in racialized communities. And we now have to look at how can we support communities across BC to move on, to recover from that, and to build back stronger and more resilient. We know a lot more about this virus now than we did in March. We know as well about the impacts of the measures that we put in place in March and who they're affecting and how. We need to know, to continue our job, all of us, to slow the spread of this virus, because we know that is how we can best address the inequities that have been created or been exposed over the last few months. It is about minimizing our risk of transmission of this virus, working in public health to manage the cases, the outbreaks, the clusters as they arise, and to modify our behavior as we find out risk situations. And we've been doing that, and we need to continue doing that, all of us. Our actions make a difference. Our actions can inspire others to do the right thing. We need to all be role models in our community and our family, to use the tools that we have to support all of us and keep our communities safe. And we need to do it every single day. And we also need to ensure that we continue to be kind and to be calm and to be safe. Thank you.